Namaskar and welcome. I am Pia Jyoti Kachru coming to you from our ITV Gold studio in New Jersey. And today on Face to Face, we have with us Dr. Tushar Patel, President of Indian Health Camp of New Jersey, a non-profit which provides free health screening and education since 1998. Dr. Tushar Patel has also served as a Director of Healthcare Quality Management for Department of Justice at Federal Bureau of Prisons for 27 years and retired in September 2020. He's also involved in many non-profit and community organizations in New Jersey to provide leadership and bringing the community together. A passion in music and medicine and connecting people with music and medicine. He's very talented and highly skilled, as well as lots of fun to talk to. So let's welcome Dr. Tushar Patel to ITV Gold. How are you, Dr. Patel?
Thank you so much, Pia. Thank you, ITV Gold, for having me on this wonderful month of February, which is Valentine's month.
Absolutely. Thank you so much for coming to us in the month of February and talking about, heart health. So let's talk first about the stats about the heart health in US.
So, Pia, first of all, February is a Valentine's month and also Heart Health Awareness Month. For me, it's okay to celebrate Valentine's Day once a year. But heart health should be celebrated every month, in fact, every single day. Because my personal experience with my patients, my friends, my family, each year I lose a good friend or a person I knew very closely from sudden cardiac arrest, which upsets me that what happened there. So the prevention is the best approach in heart disease, as steps taken can help reduce long-term complications. So let's talk about the statistics about the heart disease. So every single year, 600,000 people die of heart disease in the USA alone, which is 1 in every 4 deaths. Most common type of heart disease is coronary heart disease, which is like simple heart attack. It kills more than 350,000 people annually. So approximately 1 million Americans have a heart attack in a year. Of that number, from that number, 610,000 individuals had their first heart attack. That means more than 325,000 who already had previous heart attack and getting a second heart attack, which is very, very deadly. Let's talk about the cost associated with this coronary heart disease or the heart attack. More than 100 billion we spend each year for the health services costs, medications, and lost work productivity. So it's a very costly, very painful process when someone is having a heart attack.
As part of our education, can you tell us, what are some of the warning signs of heart disease?
Yes, so people get chest pain, chest discomfort, upper body pain or discomfort in the arms, back, neck, jaw, or upper stomach area, which is most people understands or rule out that they have a gas or a bloating sensations, and they disregard the actual symptoms of heart attack. Also, shortness of breath, nausea, lightheadedness, or cold sweats are the most common signs during the heart attack. So the knowledge is power. Acting fast is the key in heart disease and the stroke especially. So timely calling for help, 911, ambulance services, paramedics, save lives and reduce long-term complications. One other advice I would like to give to ITV viewers is never drive yourself or your family member drive you to the hospital if you have a chest pain or suspect having heart disease. So that's a very, very key message right there.
So, Dr. Tushar, since we are talking about, heart disease, we are talking about stats, can you tell me, are there like different warning signs for women when it comes to heart disease?
So the warning signs are both same for men and women. However, there are some risk factors we need to understand. So people with diabetes, people who are overweight or obese, people who have poor diet habit, people who are physically inactive, sedentary lifestyle. Right now we are going through this pandemic and most of the people are working from home. So they are probably sitting on their desk or the chair for 8, 10, 12 hours. Excessive alcohol use and smoking. These are the most common risk factors. So let me break this down into two different categories. Number one, factors you cannot change. So there are something you cannot change. If you are a male or a female, your gender you can't change. Your age 45 or older for men and 55 or older for women is most likely you are at risk of getting heart disease. Family history or genetics, early heart disease in your family, your father or brother diagnosed before the age of 55 or mother or sister diagnosed before the age of 65, you have a high chance of getting the heart disease. These are the factors you have no control. These are given by the God, you can't change it. However, there are some factors, human being, we all have a chance to change, and those are smoking habits. If you are a smoker, please quit smoking, stop smoking now. If you are a hypertension, if you have a high blood pressure, get your blood pressure under control. If you have a high cholesterol, get your cholesterol under control. If you're overweight, obese, have your physician work on you, have a dietitian give you a good diet. If you're a diabetic, if you have uncontrolled diabetes, get the diabetes under control. And the last thing is sedentary lifestyle modifications. If you don't do enough exercise, if you don't move around, your chances of getting heart disease is very, very high. So these are the most common things, common risk factors you can control and you can control.
Absolutely. You know, as you were talking about cholesterol levels, diabetes and stuff like that, you know, I have to say I definitely do watch all my lipids, whether that's cholesterol, whether that's triglycerides, etc. So, doctor, tell, you know, our viewers some of the numbers, you know, to keep in mind when it comes to cholesterol or to blood sugar levels.
Yes. So let's start with the blood pressure. Is a very, very important number right there. Blood pressure should be 120/80 for individuals of all ages. Now, if your blood pressure is 130/85, you want to consider some kind of intervention, some lifestyle modification, some dietary modifications. If that does not get controlled, you want to speak with your physician, get the consultation with your physician to get that blood pressure under control via either medications or other modifications. Your cholesterol should be less than 200. Your LDL, your bad cholesterol, should be less than 100. Your HDL, your good cholesterol, should be more than 40 in men and 50 in women. So if you have a less HDL, if you have a less, for men is less than 40, women less than 50, your chances of getting heart disease increases. Your blood glucose or blood sugar level, it has to be under 100, but no more than 126 fasting levels. So these are the common numbers you want to keep there in mind. One other number I would like to give your viewers is BMI, your body mass index, which is an indicator of your high body fat in your body. It's a screening tool, it's not a diagnostic tool, but it's a very common ground for measuring the body mass index. And the normal BMI should be under 24.9. Overweight is 25 to 29.9. Obese range is 30 or higher. So your goal is to keep your BMI, body mass index, under 25. So these are some common numbers. There are some other numbers can go in a discussion with your physician or your cardiologist, but these are some of the common numbers you can measure home. Have your blood pressure machine or your blood glucose machine at home.
So, doctor, tell me, you know, as you were saying that they can measure their blood pressure or have the, you know, the diabetic machine where they can check their numbers, but can like anybody get it like over the counter, all these machines, or they have to have it, you know, prescribed by a doctor?
So blood pressure machine, blood glucose screening machines are over the counter available at your local pharmacy, at CVS, at Walgreens, any other store where you can buy the equipments. This does not require any prescription. If anything requires, as far as the prescription goes, your physician should be able to give you that prescription. But for diabetes check machine and your blood pressure machine, you don't need any prescription from a physician.
Wonderful. So, let's focus now on the lifestyle and exercise. And, there is a lot of focus on it also right now. So, can you just give some of the tips to our viewers? How can they be healthy? How can they improve their lifestyle?
So every February, I write an article about Heart Health Awareness Month. And again, this year, I just wrote an article and I mentioned there 7 steps to a healthier heart. So the first one comes in there, live a smoke-free life. So if you are a smoker, quit smoking, because smoking not only give you the cancer, but also the heart disease and many, many other complications in your life. So if you are a smoker, try to quit smoking as soon as possible. Get some intervention from your physician. Get whatever therapy you need to quit that smoking. Number 2, monitor your blood pressure. Keep it below 120, 80, that is the normal blood pressure. You want to maintain that. The third one is maintaining a healthy weight. Target your BMI less than 25. Earlier I mentioned as well. Watch your cholesterol level. Strive your cholesterol number to less than 200. Control your blood sugar. Keep your fasting glucose or sugar level under 100, but no more than 126. Get active, avoid sedentary lifestyle. So my definition of get active is 30 minutes exercise, walking, jogging, biking, whatever you like. That you don't have to go to gym now. You can do everything home. If the weather is good, you can go outside and walk and jog and bicycle, whatever way to keep your heart rate go up. 30 minutes times 5. So 150 minutes exercise per week, which is not that much. If you have that, get the activity to keep your heart rate going, you will be in good shape. And the last one, number 7, is eat a heart healthy diet made of vegetables and fruits, whole grains. Avoid red meat if possible. Limit sodium, saturated fat, and added sugar. If you do this, you can have a healthier lifestyle.
Dr. Tushar, you said it very well. They can exercise anywhere. You don't have to have a membership for gym, or you don't need to have expensive equipment to exercise. All you got to do is just walk. And I think I really like that part about it. So, I was just wondering, do you think, Dr. Tushar, that all the, South Asians especially, are they more susceptible of heart disease?
Yes, absolutely. And one of the reasons we are having this heart disease issue is our diet. We eat diet with oil and with rice, more rice and chapatis. All those things has high number of calories. So the body requires what you take needs to be out. So your intake and output has to match. If it doesn't match, you definitely get some kind of metabolic disorder, which means diabetes, hypertension, cardiovascular disease, heart disease. So for South Asians, we are prone to get those in our genetics of getting the heart disease. And I think which we cannot change. However, we can take some steps to reduce our chances of getting the heart disease and sudden cardiac arrest. So there are few things I would like to also tell our viewers, that if you have a diabetes, if you are a hypertensive, if you have a heart disease, have your physician see you every single year. Have your cardiologist see you on a regular basis, or at least have once a year physical exam if you are otherwise healthy. Talk to your pharmacist and understand what you are taking. and what are the possible side effects and interactions with other medications. One example I can give you, a lot of parents are coming from India with multiple medications with them. When they go see the physician here, he or she prescribe them another medication, and probably they are doing a polypharmacy which they don't have understanding that it can interact with their medications. So it's a very risky situation for those parents. The third thing is talk to a dietitian if you are overweight, have a diabetes, hypertension, kidney disease, or heart disease, because diet modification will definitely help reducing the long-term complications. Learn how to reduce stress. Okay, we are living in a high stress life, and you need to learn the life with what's happening in your surrounding. You need to cope up, you need to learn how to cope up with what's happening surrounding you to reduce the stress level. And one last thing I would like to add is, besides your physical health, mental health is very, very important. So if you have any kind of depression, anxiety, or any other kind of mental health disorder, see a psychologist or psychiatrist for counseling or some form of treatment. And the last but not the least is oral health. With physical, mental, and oral health is equally important. So have the examination or the evaluation done by a dentist on a regular basis, which also reduces the complications in the medical side.
Absolutely. You're talking about the mental health, especially in these times, tougher times for everybody. And I think everybody should make it a point, just go out, get yourself checked, or even just, talk to a friend. If you are not, what happens to us, doctor, is sometimes we, South Asians, we're very shy people. We don't want to tell our problems to anybody else. We are like, no, we don't want to talk about it. And we just, keep it to us. And that creates a bigger problem. So it's very important, talk to your friends about if you have, any mental health problem or anything, and go to a doctor and, get yourself checked. And I think that is the best way to do stuff. So especially, talking about this COVID times also, do you think, Dr. Patel, that there is like an increased incidence of heart disease?
Absolutely, because, for last 2 years, we have been going through this cycle. Every few months, we are getting the ups and downs in the COVID cases. And personally, and many of us lost a lot of friends and families and people they know from COVID. So we are all stressed out. Things are getting better now, but that mental health impact us on our physical health as well. And a lot of people developed anxiety, depression, not knowing what will happen tomorrow. I think those things are not helping in their physical health as well. And a lot of people develop many kind of, not only heart disease, but diabetes, hypertension, obesity, and many other chronic diseases. So it's very, very important for all of us to understand that the COVID is not going to be here forever. So we need to learn how to live our lives with whatever recommendation is given by the CDC and the government on keeping us safe, but do our normal stuff. There is no need for social isolation. We can do call people, we can do Zoom call, we can do many other activities staying at home. There should not be any reason that we have to have a social isolation. We need to have a physical isolation at one point when we had COVID cases, but now there is no reason for us to have those isolations. We can call friends, we can meet in a smaller group, and can have a healthier, productive life.
Wonderful. Dr. Tushar, before I say you want to give a message out to our viewers, I also want to tell you that you definitely are an amazing singer, and you definitely are going to sing few lines for us. But, I also wanted you to give message to our viewers about, who is celebrating this month, the Valentine's month and the Heart Health Month. Any special messages you have for that?
So my special message to all the viewers of ITV Gold is, make sure if you have a chest pain, if you have a chest discomfort, if you have upper body pain or any kind of discomfort in your arms, back, neck, jaw, or upper stomach area, shortness of breath, if you cannot rule out that what is it coming from, is it from your heart, is it from your stomach, please go see your doctor, your regular physician or a cardiologist for a checkup. Have them do the EKG, the stress test, and whatever the workup they need to do. And the last message I would like to give, if you have any of these symptoms, please, please, please do not drive yourself or your family member drive you to the emergency room. Call 911, call the ambulance, call the paramedics, and have them manage your case. That will definitely help you save your life.
And please go ahead with your wonderful, lovely, amazing singing for all our viewers.
Okay, so few lines I'm gonna sing. जो तुमको हो पसंद वही बात कहेंगे, तुम दिन को अगर रात कहो रात कहेंगे, जो तुमको हो पसंद वही बात कहेंगे, देते ना आप साथ तो मर जाते हम कभी के, पूरे हुए हैं आपसे अरमान जिंदगी के, हम जिंदगी को आपकी, हम जिंदगी को आपकी, हम जिंदगी को आपकी सौगात कहेंगे, तुम दिन को अगर रात कहो रात कहेंगे, जो तुमको हो पसंद वही बात कहेंगे.
That was beautiful. Thank you so much, Dr. Tushar Patel, for talking about heart health. And of course, you know, I just want to remind everybody, make sure you do take care of yourself, and also remind all the viewers to follow us on our Facebook handle at ITV Gold, subscribe to our YouTube channel, and pick up a free copy of Desi Talk if you are in the tri-state area or in the Chicago area for news on community entertainment and events in US and India. Once again, want to say goodbye. I am Pia Jyoti Kachru, wishing you well until next time. Thank you.